As soon as you mention pacemaker, wash.
Yeah.
When this thing stops, my heart is gonna stop, and it's the end of my life.
Children.
Can have sex, can do anything. Of course, when it comes to kids, probably as a female, you're in a better condition to give birth. A couple of years ago, at the gym, I was walking and going to take a shower after the gym, and I heard someone say, "Hey, wake up, wake up." I'm like, who comes to gym to sleep? I'm like, wake up, sir, wake up, sir. And I look at this guy, he was not breathing. So welcome to Rhythm Unplugged.
Yeah.
Hopefully you're starting a new journey and a new family where we'll be discussing certain things and debunking some of the issues related to the heart.
Yeah.
And the things that we as doctors do. All right. Behind the scenes, someone who's helping me to be where I am right now is creative.
Yeah, creative replay.
Yeah.
Really excited for this journey. I think it's one that's needed. I think people need to know more about their health and also just learn about your journey in medicine. I mean, how many years has it been?
Yes. Went to medical school 1988. Finished 1993. That's 6 years doing internship, and then you specialize to become a specialist physician. That's 4 years. Then you do 3 years of cardiology.
13.
Then you do 2 years to become an electrician of the heart, electrophysiology. So yeah, I can sum it up. It's 4 plus 3 plus 4 plus 2. Yeah. And from medical school, it probably goes to 12, 15 years after that. Yeah.
Sure.
But it's worth it. It's worth it. So I'm a cardiologist. It means at some point I was a specialist physician, decided to subspecialize about the heart matters. And after that, I decided to do the electricity of the heart. And some of the podcasts subsequently will be talking or touching on that. So why did I decide to be an electrophysiologist rather than just being a cardiologist? It's a topic on its own. Yeah.
These are big words.
Yeah.
What do you wish to accomplish with this platform, and just some of the conversations you're going to continue to have?
Knowledge is key. It's a cliche, but knowledge is key. If you have information, good information, then you're able to make sound decision and great decision about your health. You may decide not to do anything, but at least you know what you have, what are your options. So the most important thing is impacting knowledge and what's out there, what you can achieve once you have that knowledge. And also, I think we did touch on this subject some time back that only 14% of South Africans can afford private medical practice because it's just unachievable. It's expensive. So when you have platforms like this, where you don't have to pay anything, but you can get some kind of knowledge about things that are out there that we'll discuss in this podcast. At least you will know what's available, what you could be suffering from, and potentially if there's help out there for you.
That's good.
So I think for me, knowledge is key. Yeah.
That's good.
Yeah.
No, really excited about this, and I really hope the listeners are also just excited to join us on this journey. Yeah. As we debunk, speak wisdom, and get knowledge about our health. Even myself, I'm excited about it because, I also want to grow in the knowledge of health. So what are we discussing today?
I think the biggest thing I've touched on my previous talks. Today we're going to talk about devices in the heart. When does one need a device and how does it work? Device will be something like this. So we're going to talk about 3 kinds of devices in this series. One is when you go to the doctor with symptoms that are real to you, and the doctor says everything is fine, and maybe the following day you drop dead, God forbid, where we couldn't get a diagnosis because some of the things we cannot elicit while you're at bedside by examination, bloods, x-rays, any form of imaging. You need something that will monitor you. So we're going to talk about a diagnostic device that can be inserted within few minutes and able to monitor your heart. so that you can correlate your symptoms to what the doctor can then see.
That's good.
All right. That's a loop recorder. We talk about that. The other one is a pacemaker. I've said this before. If you pray for the rain, you cannot complain about the mud, right? As you get older, you get all these degenerative conditions that probably, if you had seen a cardiologist 40, 50 years ago, these conditions were either rare or unheard of. But now, because we're getting older, we start getting certain conditions that affect the electricity of the heart. I'm the electrician. Who is a cardiologist? You get gray hair, you get wrinkles. The heart also is not going to function as it did when you're 20, 25, or 30.
Good, yeah.
So pacemakers become big part of our lives. A lot of people out there would have had someone who needs or have a pacemaker or had a pacemaker. And then the third component is a defibrillator. Who needs a defibrillator? So we've seen in animation or in movies when someone collapses.
Yeah.
You have to either jump on their chest and do resuscitation.
Yes, yeah.
Or shock them back to life, right?
Yeah.
If someone has a cardiac arrest, not heart failure, not heart attack, cardiac arrest when the heart suddenly stops beating, one of the two things. Pump on their chest until the ambulance come, if you are lucky.
Sure.
Or defibrillate them. And I'll give you an example, because this is how it works in our country and many other countries as well. Is a couple of years ago at the gym, I was walking and going to take a shower after the gym, and I heard someone say, "Hey, wake up, wake up." I'm like, who comes to gym to sleep? I'm like, wake up, sir, wake up, sir. And I look at this guy. He was not breathing. Tongue was stuck out. He was having a cardiac arrest while he was exercising. But guess what? This was at the city center. It took an ambulance more than 45 minutes.
Yeah.
Can you imagine if you're in a township where your help is not accessible? So a certain device, if that had been picked up prior, could have saved his life. Well, fortunately for him, it did. It did well. He's still alive. But yeah, these are the things that can be...
45 minutes later?
Well, because we had to resuscitate him.
Oh.
Yeah. So what I'm saying is that if someone has a cardiac arrest, there are two things you can do. Jump on their chest and pump the chest to help the heart pump, or defibrillate them back to normal rhythm. This is a defibrillator.
So while you're at it, this whole thing of pumping the chest, how much pressure should it be? Because...
Break the ribs.
That's what I always hear in medical series. So is it really...
Yes.
That much pressure?
Yes. Just so remember, there's a heart, then there are lungs, then there's muscle, then ribs, then there's fat. So there's quite a distance between where you place your hand to where the heart is, right? So you need first a heart frame, ideally. If someone is having a cardiac arrest, on their bed, you rather put them on the floor, hard surface, and then pump as hard as you can. So breaking the wrist is the last thing that you should be worried about.
So I'm using my weight on it to get as much pressure as possible.
Yes.
Okay, so it's not just the thing they say, well, my series, to break the ribs.
No, it's break the ribs.
Okay.
Break the ribs.
You see, now, to be honest, even outside of series, if I didn't know that, I would be afraid to even put that much pressure, because I'm thinking, I'm doing the right thing, but you might find that I'm actually not even doing anything at all, because I'm not putting the necessary pressure in order for...
Yeah, but of course, you're not going to put the same pressure on a neonate or newborn or skinny little kid, right? But if it's an adult, lots of pressure.
But even
the fatter the patient, the more pressure you need.
I'm a big guy. That means
the more muscular guys get such huge amount of muscle mass. You have to push hard. Got to push hard.
But even that is nuanced, because now you are mentioning, Guti, if it's a newborn or a 5-year-old versus an 18-year-old up. I think for you it's normal, but for me listening to it now, I'm realizing there's actually a nuance in terms of the amount of pressure that you put.
But the more pressure you put, the better. You rather err on the side of putting more pressure than not pressure, because then if you're just doing insufficient pressures, then you're not giving what you call a cardiac output, because every time the heart beats, we call that cardiac output. You want the heart to pump or assist the heart to pump as hard as you can.
Okay.
And that takes a toll. That's huge exercise, right?
Yep.
So you need the ambulance to be there within 10 minutes. So if you've got a genetic predisposition, or you've had a heart attack or heart failure, then you either have, you're always hoping for someone who knows how to do resuscitation and feed, because they can know how to do it, but 30 minutes later they are tired. That's when these devices come in handy. But anyway, today we're going to talk about devices, or we have started talking about devices. So we're going to break it to 3. Diagnostics, which means that we insert something just under the skin, not into your blood vessel, not into your muscle, and definitely not to your heart. It's just a monitor that monitors your heart. And the good thing about the loop recorders is that now we have what's called home monitor. It's almost like a cell phone that goes with this monitor that we insert. You just plug it next to the bed, wherever you are in the world. We have a virtual clinic. You can tell us what's happening with your heart. Could be in Zimbabwe, could be in Argentina, and I'm sitting here in Durban. I'm able to monitor your heart.
So it sends data across.
Yes. Yeah.
Okay, that's good. That's good.
Yeah.
Your technology has advanced.
So that's a loop recorder. Particularly, you find that, once again, I've never been a female, but unfortunately females they're not treated as well, and there's clear data there compared to men. So if you have a twin brother, you both have the same symptoms, go to the same doctor, maybe different days, you are likely as a woman to be given a diagnosis that is all psychogenic. That means it's all in your head. Oh, doctor, my heart beats fast. And then they ask me, oh, do you have marital issues? You got this. But if it's a man, they tend to be more attentive. That's how it is, as bad as it sounds. So we find a lot of females are being dismissed and saying they have psychological issues when actually they have a condition. But remember, the rhythm disorders as electricians are based on ECG, a piece of paper. If you've got palpitations, that means awareness of the heart. And when you get into my examination room and suddenly it stopped, there is no way I can retrospectively say 2 minutes ago what you had.
Okay.
I can do MRI, I can do CT scan, I can do blood work, I can examine you thoroughly. I will not be able to tell in most cases. That's where these diagnostic loops that we implant then give us, or at least a patient, leverage to be able to be mobile and be everywhere they want, knowing that it's almost like they have a mobile doctor with them.
That's actually good.
And they don't stay forever. They usually have a battery life of about 3-4 years, depending on the company. And taking it in, putting it in and taking it out, it's about 10-15 minutes. It's a day
But it's
procedure.
obviously used to diagnose rather than you keeping it for that long.
Oh yeah, so I mean, you can put it on day 1 and the patient has symptoms on day 3, and if you're satisfied with what we've seen, then you schedule the patient to take it out. So it doesn't have to stay there for that long.
Yeah. So for these 3 devices, generally, is there an age group of people who needs them, or what is it based on? Who needs these devices?
Well, it's not age dependent, but we know that the older we get, we're more likely to get these symptoms, because most of them are degenerative. But there are kids who are born with abnormal hearts. It's really directed by the symptoms, right? So I'll give you an example. If someone has heart failure, the heart that does not pump well, right? That's a relatively easy diagnosis to make. Examination, history, echocardiogram, ultrasound of the heart, we're able to pick that up. But if it's electrical, I need to be there and do the ECG, then I give you a diagnosis. But if your heart awareness, what we call palpitations, stop just before I start examining you or do an ECG, then I may look at you and say, oh, something wrong in your head, when actually you have a condition. Yeah.
Hence why you obviously need to put the devices.
Yeah.
So what I'm hearing is that devices are really dependent on either if you're diagnosing or if you're treating?
Yes. So the devices, we subclassify them as diagnostic, where, like we said, you go to the doctor, the symptoms are gone, you say, well, 2 weeks ago I had this awareness of the heartbeat, I was dizzy, or I collapsed, and by the time I got to the doctor, they told me everything is fine. If those symptoms are real, and they should be real because you came to the doctor, then it's a loop recorder. The loop recorder is diagnostic, it's not therapeutic. And then once we know what's wrong with the particular patient, why you collapsed. Did you collapse because your heart was too fast, or was it too slow, or was it irregular? Then you may need either a pacemaker or a defibrillator. And just quickly debunking one of the things that make people of color, particularly Africans, it's easier for me because that's who I am, and I live with those people. Is that as soon as you mention pacemaker, wash.
Yeah.
When this thing stops, my heart is gonna stop, and it's the end of my life. That's the biggest hogwash out there. It's got nothing to do with clock. It's not a clock. It's a pacemaker. And if people were to stop using that terminology, we're probably going to be saving a lot of people, because as soon as people say it's a clock, and when this clock stops,
time attached.
There's time attached, So, but it's not
one
true.
Of those people.
Absolutely not. Yeah. It doesn't make sound. You don't feel it work. It's just something that we put just below the left collarbone and wire to the heart, and looks like that. So it's a simple procedure that saves life. But it's not just about saving life, it's also about the quality of life. Because there's certain things. So as you get older, like I said, you get gray hair, you get wrinkles. You can treat wrinkles with Botox. I don't know if you can treat gray hair, but some of the things, they're just not reversible, and there's no pill for it. So if your heart is too slow, and everything has been checked that you're not taking medication that makes your heart too slow, or your thyroid is producing enough hormone called thyroxine, which is important for your heart rhythm and rate. And if those things are normal, there is no pill one can give you to raise the heart rate. Therefore, generally, most of these patients require a pacemaker.
Sure. While we're saying that, getting these devices, how does it impact your life, either socially, professionally, your health?
Yeah, all right. So obviously, generally one needs a cardiologist to make the diagnosis who needs it, right? And then we discuss with the patients. Because everything that we do, there's always a risk. And generally, if you go to a doctor, we implant pacemakers, the risks are not that high. It's all relative. 2 to 3%, it can get infected, the wires may move, but that's 2 to 3%. So it's quite small. It's not negligible, but it's quite small. The upside is that most of these devices, 2 things: better quality of life, and we'll talk about that just now, and longevity. Okay, we're not God, but if you need a pacemaker and you don't have access to it, or you decline it, there is a very good chance that your life will be abbreviated, you'll die.
Sure.
Right? So when it comes to life, you're going to live longer. Generally, if you have a pacemaker, you'll be able to have a better quality of life, less doctor visitations, less hospital visitations, which is less money you're spending, more time with the family, more time at work, right? Physically, if your heart is too slow, you won't be able to exercise or engage in social activities, right?
Sure.
Because you're dizzy, you're tired, all you want to do is sleep. Can't breathe well. So in terms of quality of life, it improves almost all, if not all, those symptoms,
sure.
Right? Professionally, if one has a pacemaker, there's just about nothing you cannot be just because you have a pacemaker. Can be a pilot. I'm not sure about commercial, but you can fly your own jet plane. We have patients who fly. So having a pacemaker doesn't preclude you from having any kind of profession. You can use a cell phone, you can use a microwave, a lawnmower. You know, the only thing that probably we don't like is arc welding, because the electrons, they interfere with pacemaker. They don't damage the pacemaker, but they confuse the pacemaker. They may either make the pacemaker not to work, because when it sees these electrons, like when you do arc welding, the pacemaker thinks your heart has recovered, because it's an electrical activity, right? And stop pacing. That's a problem.
That is a problem.
On the other side, if it's a defibrillator, we'll talk about the defibrillator just now, it may shock the patient because it sees the heart rate that is too fast, right? So maybe arc welding, I can't think of anything that one can not do just because you have a pacemaker.
That's good. So I think you mentioned some of them, but I think it takes me back to, then what are some of the common misconceptions about these devices? I would think one of them, or maybe isn't a misconception, is actually, maybe it's not a misconception, maybe it's a question. Can I still have children? If somebody wants to have children, you know, does it affect having children?
Can have sex, can do anything. Of course, when it comes to kids, probably as a female, you're in a better condition to give birth naturally or undergo cesarean section because your heart is in a good space. Fortunately, pacemakers are for older people. So by the time one needs a pacemaker, most of the time you're like 65 years and above, but of course you can have a baby. There are a subset of patients who are born with abnormal pacemaker. Okay, everyone has a pacemaker, inborn pacemaker. Everyone who's living.
Inborn,
So if the baby is born without a functioning pacemaker, we put pacemakers in kids. Usually can wait till about 15, 16, mid-teen and put in a pacemaker. And then those people can have kids absolutely fine.
So a newborn baby cannot have a pacemaker?
No, they can, but generally their electrical system, even though it's flawed, they're able to go to mid-teens without needing a pacemaker, but then get to a point where we need to implant a pacemaker. So if someone is born without a functioning pacemaker, but just enough, they usually make it to mid-teens and 20s, and then we try to put a pacemaker before they get sick. Obviously, if someone is born with no heartbeat, then it's going to be a stillborn, right? Yeah. So that's a different story altogether.
Yes, yeah. So and then the other one is the battery's going to run out?
Yeah, so these batteries, they will run out, but obviously getting monitored. And now for about 15 years, maybe closing on 20 years, we have what's called a home monitor. So if the slow heart rate is your only medical problem, we give you a monitor that you plug next to your bed. Within 3 meters, 6 meters, wherever you are, it's able to communicate with your doctor via virtual clinic. We're able to see how your pacemaker works. We cannot reprogram it remotely because can you imagine if you're totally dependent on a pacemaker and a hacker or machonista and then decide to say, hey,
my money's not coming in.
Yeah. So you can see the doctor maybe in 6 years because the defibrillators last about 6 years. The pacemakers last longer, 10, 12, 15 years, depending on the make, the need. Yeah, so there are ways and means to monitor it. It just doesn't stop suddenly.
And then the other one is, will I still have feelings? Because people are thinking about the heart. Now I have a pacemaker, it's mechanical.
So when you have feelings, what do you mean? Emotional feelings?
Yes, emotional. Will I still,
sex emotions?
No, just emotion in general.
But doesn't interfere with you that way. Okay. One of the things that you and I have discussed outside the podcast is mental state and the heart. We'll touch on that in the future. Of course, I'm the cardiologist, electrician. I'm not trained in mental issues. So one of the things that we miss more, because you've touched on the feelings, is being aware that, for me, sitting on the other side of the desk, it's easy to look at the piece of paper and say, you need a defibrillator, you need a pacemaker, you need a loop recorder. But we forget that we have a patient who's got feelings, got emotions, uncertainties.
Sure.
That's when our colleagues, psychologists, psychotherapists, and maybe psychiatrists will come in. But having a pacemaker does not mean that it interferes with your physical feelings, but it does, of course, affect your head, I think, mentally.
Sure. Well, are there other misconceptions? I'm trying to think of some that maybe you might be leaving out that people often have when it comes to putting devices in them.
Yeah. Well, the other one that people don't talk about is, so we've spoken about the diagnostic, which is just diagnostic. It doesn't give any therapy. And we've spoken about a pacemaker. Then there's a defibrillator.
Yes.
Yeah. You've seen these top elite athletes, rugby, soccer, and then just suddenly die or collapse on the pitch. They're usually born with certain conditions that make them prone to cardiac arrest. And, and generally, medication may work to a certain degree, but they need a defibrillator, all right? A defibrillator for us is like if you have 500,000 rands and you need to buy a car, you're not going to buy a car without airbags, right? It just gives you that comfort that if I'm met with an accident, chances I'm going to survive. But you're not going to drive to a tree trunk to see if the airbags do work, right? So defibrillators, we insert them with the hope that the patient will never need it, but in a case they have cardiac arrest because they are prone. Obviously, we risk assess and say who needs this and that, and usually runs in the family. If we often hear people went to bed fine and then they never woke up. And if you have a sibling who has had that unfortunate event, it's imperative that you need to go and see a cardiologist because it generally runs in the family. It's genetics, particularly if they're under the age of 40. A 39-year-old goes to sleep feeling well and never wakes up. It's a usually genetic predisposition. And one of the things that could have saved their lives is a defibrillator. Now, coming back to your question, I know it was convoluted answer, is that one of the way it works to get their heart back to normal rhythm within few seconds is to shock the patient back to life, right? A shock to the patient is painful, but saves lives, so you have to pick your struggles. And but the partners often worry about, what if I'm having sex with my wife or my husband and gets shocked? Will I get shocked? You may feel maybe sudden movement, but no, you're safe. So other people, and you know, because also doctors, we're not good at certain things. Patients may not ask you, but it creates an anxiety that, what if my partner gets shocked? Will I get shocked? Will it affect me? You know, and that, you know, no, the answer is no. The answer is no.
Yeah, I think that's so good.
I think the misconceptions are important because they hinder the likelihood of someone getting therapy. About 3 months ago, I was invited to give a talk on pacemakers because I do a lot of pacemakers and these defibrillators. And I had a colleague of mine that I trained with. She's from Pakistan. And she gave a beautiful talk on social issues and defibrillators. In that part of the world, I don't know much about Pakistan, so I can't say everyone, but she was giving us a talk on social issues and misconception, like a young woman who has a pacemaker or has a defibrillator is shunned upon by the nation. The God doesn't like you. That's why you have this condition. Difficult to find a partner because you're not worthy because you have this condition or device. So it's difficult and suicide then becomes slightly higher because, you know, you're shunned by the people who are supposed to love you and protect you. God put a spell on you, doesn't like you, that's why you got this. And some of them will actively decline to have this so that she can get married, or the husband doesn't divorce her, or she's not shunned upon by the people she lives with. So it's very sad, and it takes us to all spheres of life, right?
That's true.
Yeah.
Is there a test that everybody should do to check if their heart is right, or is it usually something must happen, then you go for a test?
A tricky question, but you don't want to cause anxiety to general population, because it's not most. It's a few, but significant who require this. So generally, we wait for the event to happen, fortunately. But once you go past age 40, for instance, if you have indigestion for the first time in 45, you never had indigestion, and you look back, then you eat anything that could have caused indigestion, you could be having a heart attack.
Sure.
Get checked. If you collapse or feel quite dizzy for no particular reason, it's worth checking. Now, once again, you don't want to cause anxiety. I can't think of anyone at the age of 40, 50 who's never felt a bit dizzy. I drank too much, dehydrated, maybe over-exercise, I haven't eaten. I mean, that's okay. But if you can't put a finger on it, especially if it keeps coming back, get checked. So we either wait for the event or family history. Like I said, if you've lost a sibling or a parent under the age of 40 for no apparent reason, get yourself checked. If someone went to sleep and didn't wake up and they didn't have any serious medical condition, get yourself checked. And then if you're outside that particular high risk, then if you're over 40 and you smoke a lot and or drink a lot, particularly smoking, then it's worth at least having a check with the doctor, right?
No, I think that's good.
So not everyone needs it.
Not everyone needs it. But I think you explained it well, because then we're also then able to pinpoint whether you should get a test. But it doesn't, because I think what you're also trying to say is that it's not that people mustn't go for the test, but it's that you don't want to put everybody in a panic where now everybody feels like they need to go for a test. So you've at least given some markers, maybe to try and use to say, okay, I fall under one of these markers. Let me maybe go in and do a test. I think this is so good. In closing for the first episode, are there any more misconceptions, and what can people expect from this podcast?
Oh, well, obviously there's no way we could have covered everything. Like I said, for the first time when a colleague of mine gave me a talk about heart devices and her country, I mean, I'd never thought of it that way, right? So we can't cover everything, but it'd be nice if people can reach out with their concerns, and then we can advise accordingly. More often than not, we have answers, but sometimes we don't. But we usually have the answers. So in closing, I think the most important thing for me is impacting the knowledge. Because the more you know about your heart or your health generally, the better decision you will take. But I think today, one of the most important things, if there's just one message, devices are not clocks. Devices are e-wash, please.
That's good. That's
right.
Good.
Number two, if one has a device or one requires a device, there's absolutely no job except maybe arc welding. There's no job you cannot do. So you shouldn't be worried about loss of income because now it's in a pacemaker.
That's good.
Yeah. If anything, hopefully insurance companies are not listening. There's something called dreaded disease. Some of these conditions fall under dreaded disease. If it's an incentive for you, which is bad, but I mean, it's like you may be covered for dreaded disease because if you have heart attack or heart block that requires a pacemaker, there are those things
then
that you may get something.
To the insurance guys that are listening, just block your ears.
Yeah. But it's not illegal, right?
No, it's
because
not.
We've been paying for, 20, 30 years, and suddenly...
It's a benefits that you are buying. So if you're getting... So usually your life cover.
Yeah.
So you get, under your life cover, just check that you get a life cover or then that has disability. And then it's called dreaded disease or severe illness, depending on the policy at which you pick. And then from there, I think most companies cover those benefits. So I think it's also a good thing for people to know that don't just get funeral cover.
Dreaded disease.
Because what happens if, God forbid, an incident happens?
But you're not dead, but you're debilitated for a long period of time, right?
So maybe people must go review their insurance policies.
I think it's better as an individual to use your money when you're alive than the money being used on you when you're dead.
That's well said. You say some gems, some good advice from Dr. V. The Rhythm Unplugged.
Hopefully we'll meet again soon.
100%.
Ayikho wash. But one day we're going to talk about artificial heart in our next postcard.
When I hear artificial, I think of AI. So now I'm interested to know of artificial heart.
Artificial heart. Talk about artificial heart. We're going to talk about stents. What else are you going to talk about? Artificial and valve.
You want to speak about valves? Yes.
Heart has got valves. So the next time we're going to talk about valves, artificial hearts, and stents.
And then we also want to talk about life. We want to find out more about career.
Oh yeah. We'll talk about that.
See you on the next episode.
See you then. Adios.
That's good. Don't stop recording. I'm going to ask you, Dr. V, to look into that camera. This one. You're just going to say, guys, we just recorded the first episode of the Rhythm Unplugged or Rhythm Unplugged podcast. Comment the word heart and we will send it to you.
So guys, we've just recorded our first episode of many to come, I hope. Productive, Rhythm Unplugged. And for comments or misconception that you may have, please reach out to us and then we'll get back to you. Thank you.
Dr. V, you're a natural.
Wow.
Was it a dope first episode? Yeah, I'm happy. Well done.
Good.